Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you're just joining us, we are talking about tuberculosis. Express Care's Dr. Jitka Lom is giving us some great information on the topic. Let's get to some viewer questions now. Cindy from Dedido asks, what is multi-drug resistant TB and how will I know if I have it?
Okay, Cindy. Well, if you have active TB and you're coughing up sputum, then the typical treatment is 3 drugs, and those are taken for 9 months, except that if people drop out and they don't finish their medication, halfway through they drop out, then the germs that they have remaining inside can become resistant to those to the antibiotics, and then there is no other drug to be used. So then it's called multi-drug resistant. They've already tried 3 drugs, maybe a 4th and 5th, but just nothing works on it anymore. So this is just basically a reminder to finish your antibiotics, especially when you're being treated for TB.
Okay, and so Vera from Tumont asks, what do I do if my child has come in contact with someone with active TB? And that's something that happens in the public schools a lot.
It does. So if your child has been in contact, they're at risk for getting the infection themselves. So they would want a TB skin test as soon as possible, and then repeat it again in a month or 2, because again, we said that TB is a slow developing disease, and so you may not turn positive right away. It may take a month or 2 to react, so make sure your child gets tested.
Larry from Jontya asks, and we've talked a little bit about this earlier, is green or bloody mucus a sign of TB?
It really is, yep, along with weight loss, feeling sick, losing weight, and feeling unwell.
Okay. Also, Nicholas from Harmon asks, is it true that people who smoke are at a higher risk of getting TB?
They are, just as they're at risk for any lung infection. When you smoke, you're damaging many parts of your lung and also of your immune system, so you're more prone to any infection, including TB. And people that smoke are also sicker with TB and more at risk of having active TB rather than just the passive infection.
Larry from Telefofo asks, my kids are tested every year. How often should I be tested for TB?
It kind of depends on your work and your travel habits. If you're a frequent traveler off island to Asia and especially Philippines or the outer islands, then I think you should really have a test once a year. If you are someone who is around on Guam and working with people in healthcare or with elderly or with sick individuals, again, once a year for sure. Other people may go every couple or every 3 years, but you should have a regular TB skin test when you live in a place like Guam.
Okay, and our last question comes from Norman from Laddie Heights. He says, I have inactive TB. Is there a way to prevent it from becoming active?
Yes, that's when you take the 9 months of medication called isoniazid or INH. So if you take let's say 100 people who just turned positive but they're not sick, and you give them 9 months of medication, about 80 of them will never get TB. They'll be perfectly healthy the rest of their life, they'll be fine. And maybe 15 or 20 of them will still develop the active infection, but it's very, very effective in preventing the TB from getting hold of your lung.
Okay, so last messages to our viewers out there, get the skin test regularly. If you do have it and you're given the medications, take them and take them all the way through. Any other last words of advice? If
you need to have what we call a high index of suspicion. If someone in your family has recently come back from a trip and they're coughing and not feeling well, bring them in for a TB skin test so that you can be sure that they haven't picked that up while gone.
And one quick last thing is the symptoms. You were talking about the coughing, the spit up, and things like that.
Fever, losing weight, just generally feeling weak and unwell.
Okay, Doc, thanks so much. Okay. Doc will return next week when we discuss hand dermatitis. That's cracked, dry, itchy hands. If you have questions, feel free to send us a question to healthyliving@KUAM.com. There's still much more on the way. Stay with us.